Can everybody see my screen all right?
Yes, we
Yes.
can.
Perfect. Okay, so the first study we have here, it is a study that helps us or is helping us understand how the medication, which has a really funny name right now, PF-068235859, works in people with active IIM, including DM and PM. Dr. Domachki is the main PI on this, and the main study coordinator is Nick. It's a phase 3 study. Again, the drug is listed there, and the study will be conducted in two parallel cohorts. The first cohort is DM, the second one is PM. And basically, participants will be either receiving the experimental drug through an IV infusion once every 4 weeks, or they will be receiving the placebo competitor same way IV once every 4 weeks. No, why it's not letting me move forward. I guess we can keep it like this. Can everyone still see everything?
Yes, we can.
Perfect. So some of the inclusion criteria is that you need to be a male or female adult, 18 years or older, have active DM or PM with age of onset of 18 years, and you also need to be receiving a stable dose standard of care background medication at the time of enrollment, and you'll be on that throughout the study. Some exclusion criteria is myositis due to non-IIM. If you have an existing diagnosis of IBM, presence of IMNM, myositis with end-stage organ involvement, have cancer or history of cancer within 5 years of the screening visit, history of major organ transplant, and then some more. Major surgery within 4 weeks of screening, or if you're planning to have a surgery within the time of screening. If you have clinically significant depression, suicidal ideation, or previous history of suicidal behaviors. Um, and then not to bore you guys with everything, but prior standard of care medication that does not fulfill the criteria, which will be deemed by the PI. Our next study is a phase 2 study. It's randomized, parallel, double-blind, placebo-controlled study. For short, we call this study Neptunia. Again, the doctor is Dr. Domachki, and the study coordinator is Lily. This study is to evaluate the efficacy and safety of the orally admitted medication M5049 and IIM, specifically DM and PM, for 24 weeks. They're planning on having a total of 40 subjects enrolled, and then the open label extension is offered following the blinded study. So after you finish the first study that is blinded, you have the option of getting into the open label, which is where you will be taking the actual medication. Some inclusion criteria includes diagnosis of probable or definite DM or PM. As of the 2017 classification criteria with positive autoantibody status. Active disease on standard of care must meet one of the criteria within 6 months prior to screening. Um, the stable dose of oral corticosteroid and/or maximum of one non-corticosteroid immunosuppressive medication. Um, and then other protocol-defined inclusion criteria could possibly apply. There's some hefty exclusion criteria, including primary diagnosis of IBM, IMNM, and SRP. Several interstitial lung disease defined as supplemental oxygen, and then other protocol exclusion criteria could also apply. The next study, again, long name, but we just call it Jasmine for short. Um, Dr. Damachki's, again, the PI and the study coordinator is Abby. It's a phase 3 randomized, double-blinded placebo-controlled study. It's a two-arm study. This one would be 52 weeks, and they're planning on having a total of 240 subjects. It's not IV, it's a subcutaneous injection. And then again, once finishing this study, you have the option of going into the open label study where you would be given the drug. Some of the inclusion criteria is being 18 to 75 years old, body weight between 40 and less than or equal to 100 kilogram. You must have probable or definite diagnosis of PM or DM according to the 2017 classification criteria for adult myositis. Moderate or severe disease activity per core set measurements. Currently receiving oral prednisone or other polymyositis or DM treatments at a stable dose. No history or active tuberculosis or severe COVID-19. And then some of the exclusion criteria includes PM and DM patients at a high risk of malignancy, participants with rapidly progressive interstitial lung disease, participants with documented IBM, history of cancer, that kind of stuff, pretty similar. And then for women, lactating, breastfeeding, or pregnant females or females who intend to become pregnant, that's an exclusion criteria. And then I believe this is the last study, CABA 201-002. Again, Dr. Damatki is the PI, Ali is the study coordinator. It's a phase 1/2 open label study for active IIM. Their total enrollment is 18 patients. Their inclusion criteria, again, includes patients ages 18 to 65. You're going to need a clinical diagnosis of IIM based on 2017 classification criteria. You need evidence of active disease and presence of muscle weakness at screening. And then some of the exclusion criteria includes active infection requiring medical intervention at screening, significant lung or cardiac impairment, or previous CAR T cell therapy. If you guys have any questions, like I said, please feel free to ask. Both Dr. Pasnor and I are here. And then if any of the studies were something that you were interested in, we've listed the emails for the study coordinators, so you guys can take a picture or write it down and reach out to them. I'll leave this up for a few minutes, and if anybody has any questions for us, please feel free to either enter them in the chat or you can unmute yourself.
Most all of these studies are also listed on clinicaltrials.gov. If everyone is familiar with that site, it also gives it's also on the website more details if you want on the study.
Yeah, so we just tried to summarize it for you so that you can get a general idea of what to expect. But if anything, like Dr. Pasner said, if you're interested, they are on the website with a lot more detail so you know exactly what to expect.
Nora, there was a chat question on can the slides and emails be sent to participants in this session?
Um, Let me stop sharing so that I can look at the chat real quick and see. If you want to drop down your email, I can see if we're able to send you guys a summary. Sarah, you had a question about does your doctor need to make a recommendation or agree that you should participate? Um, Yes, in a sense of, it's something that you can definitely discuss with your treating physician that, this is something that I'm thinking about going into. Do you think it's a good idea? Also, whenever you do come into a screening visit with us, you obviously don't automatically get enrolled. We have our physicians evaluate you, look at your medical history, basically check everything out just to be sure that this study is safe for you and then you'll get enrolled. So you will be seen by physicians. It's not just me who will see you and be like, okay, let's just get you in.
I think there's another question in between. Is having long COVID an exclusion factor for studies like this? No, again, we evaluate you and see if your symptoms are related to long COVID or are they related to your actually having the inflammatory muscle disease, that's the dermatomyositis. And based on that, so to your question, long COVID does not exclude a person from the studies.
Do you physically need to be in the location or can a person join a study regardless of location? So for these studies, yes, you will have to come on site to do all of your visits. I think for majority of the studies at least, you do need to be on site. And then are there costs involved?
Can I answer a little more on
Yes,
that, Laura?
go ahead.
So, when you say physically need to in the location, so people don't, I mean, even if you're not uh, in Kansas and you're traveling from outside, you can still participate. But like Nora mentioned, for the visits, you may need to, I mean, you'll need to be here for the visits. But you don't have to live in Kansas. We do have in my last study in dermatomyositis, we had someone traveling 3 hours from a 3 hour distance. So there is people who do travel some from distant places to come here. So I don't know if that's the question you're asking, or if you're saying like only being here, but you don't have to be in Kansas. But as far as the visits, have to be in person. So do have to come in for the visits.
Yes, thank you for that clarification, Dr.
Yeah,
Pesman.
just making sure because I think people are worried about like, travel costs, and some studies we do, like there is some travel costs that can be reimbursed. Like, again, it depends on the study that you're participating in. So I just wanted to let you know that they do reimburse like the travel in some of the studies, and depends on, again, how far you're traveling and again, what kind of travel costs that's involved. They have to like let the sponsor know so that they would decide if we can pay or not on that travel cost.
Yes, and Sarah, that kind of goes into your question about are there costs involved? Yeah, majority of these studies, I want to say, have travel reimbursements, and then you typically will even get like a stipend per visit. Again, it varies from study to study, but I do want to say majority of them, the costs are covered.
Yeah, so I mean, Sarah, like it doesn't cost you. It's usually this is all through the research study, so it shouldn't you shouldn't be paying out of your pocket. Well, I think the question is, where is the on-site? That's a great question. So we do have a research location, and Nora, you can give more details if you can put in the address, or it's a research building which is located on Fairway. It's just about 10 minutes from the main hospital. And we can put in, share the side. It's the research where we see our research patients and where the memory clinic is actually, and even the cancer center research is also in that same building. So it's kind of a research building just about 10 minutes from the main hospital. And do researchers ever meet with larger group of patients to explore possible research study topics? I wonder if new connections might be made through liberal sharing on both sides. So that is an interesting question, actually. So some of the research studies that are being done now, um, both by the industry as well as by researchers, they do meet with they have been meeting, at least I'm not sure about like specifically dermatomyositis, but most of the conditions in muscle diseases as well as in other disease conditions, there are usually initially patient meetings also by the research developers before the study is started to develop and look at, what needs to be done, or like, what are the important things that they like to see as outcome measures. And, these all go through patients also, and not just physicians and researchers. It goes also through patients, so support groups and patient advocates and like patient. So there are, yes, I mean, to your question, yes, but I don't know if I can say like larger groups of patients, but I think it's probably more, might be more limited. Okay, I think Crystal has a question. From my personal experience, if you live in another state and receive more than $600 stipend, you will need to pay taxes in the state you reside and the state you received the stipend from. Well, that is a good. I mean, I don't know the specific, Crystal, so, I mean, what you might be saying may be true. I don't know the answer, but, that's something which we may have to explore. Like I said, our patients do, I mean, we do have patients coming from other places. So again, I don't know all the details of like how much stipend that they need to pay the tax on, or, is it taxable, non-taxable, or if what's the difference? So, yeah. Thank you, Jen, for the Jennifer confirming that.
Yeah, Sarah, to answer your question, typically, we wait until everybody has finished the study, and everyone has completed the study, and then you will be able to know if you've gotten real drug or placebo. So depending on how long the study is, like I mentioned, some were 24 weeks, some were 52 weeks. So at the end of that, once everybody's out of the study, they typically will then let you know if you were on the real drug, if you were on placebo. We got another question. If the treatment is successful in the trial, can you remain on the drug? Yes. Like I mentioned with a lot of these, you will typically the study is either blinded where you have either placebo or drug, and then there's an open label study that you can choose to go into after where you're for sure getting the drug. They will keep you on that until they decide to close the study, and then essentially when the drug is on the market, then you'll be able to get it through insurance or purchase it. But yeah, if it's successful, yes. And if it's safe and if it's deemed safe and successful, yes, you will be able to continue on the drug. So answering the question about if we usually have enough volunteers for studies or if we have to reach out to people, it's a mix depending on the study. We have some observational studies that don't involve drugs that sometimes we do have to reach out to participants and see if they're interested. Those are typically to help us learn more about the disease. So we do typically with those sometimes have to reach out to people and see if someone's interested. And then there are studies that are drug studies that a lot of people are interested in getting into, and people just come and talk to us and reach out to us to see how they can get involved. So it's really a mix of the two, depending on the study.
I think that's a great question on anti-synthetase syndromes. I don't know, Nora, if you have any, but I can try to answer that
Go
question.
ahead. I was actually going to ask you to answer.
So, probably a difficult one for you, but so these sub group of the inflammatory myopathies are again more rare than the inflammatory myopathies itself. So it might take some time before we see like another study specific in this group. I know there was one, again, the clinicaltrials.gov might show us like if there's anything that's upcoming, but I didn't get a chance to look at it today this morning to see if there is any specific ones coming up. But usually, because these are rare disorders, it's very hard to enroll patients. So it gets difficult to do studies specific in that area of research in specific in that condition. But I'm sure there'll be in future as we are identifying more patients with this condition, we may have more interest and by the industry on specifically in this condition, and we'll see more studies coming up. So to your question, I mean, yes, there'll probably be initially we'll see like all of them lumped into one, probably lumped into the inflammatory myopathy category, and then maybe subcategorized specifically to these conditions. I'm trying to remember if there was a IVIG study that we will anti-synthetase syndrome. I think there was one in Amsterdam along with the steroid therapy earlier on, once IVIG study in just anti-synthetase syndrome. But I have to see if there's the results or so. Yeah, hopefully in future we'll see more of those. I agree that it would impact the insurance coverage. Sometimes we have to give them the diagnosis of inflammatory myopathy, and some insurance wants specific diagnosis. Some insurance cover a broad umbrella. They might say inflammatory myopathy will cover, all of that, but sometimes they want you to specify like either only dermatomyositis can be covered with this medication, or, I agree. I mean, I think it would be nice to have more studies in each individual. But as Nora and, mentioned that sometimes these studies are very difficult to enroll, and we don't I know, I mean, I know most of you want to help out, and but some of you may not qualify for the studies because of being on particular some kind of medication already on, that is an exclusionary medication, or may not have the amount of weakness that is required for this study. And so we always struggle to enroll patients in some of these studies, so although, the enrollment goal is like 200, but if you look at it like US, again, it is a slow enrollment in most of these studies from US. Unfortunately, that's why I think it's always difficult to do studies, I mean, to enroll. And if someone is really doing good, why would you like to change to a different medication? And we understand that. And the next question is, funding readily available for these studies, or are they considered orphan diseases? So funding is not readily available, but yeah, again, it depends on which condition we're looking at. Orphan drug designation, or, you can probably get some of the medications through that, but research funds through that. But again, any funding is difficult. But I have to say, most of these studies that we talked about here are through industry. So, I mean, investigator-initiated trials are, we also do that, and we do have some of them upcoming. Again, I think, there are like CAR-T trials and others, which I mean, we didn't mention it here because we are not yet ready for those, but there are some investigator trials that are coming up also that we are waiting for funding, or waiting for finalization or something like that. But most of the studies are through industry right now. Trying to see if there's any other questions. That is a great question. Some of the research funds, federal and in danger of being cut. I don't see that in this area of it right now. I don't think, at least the research that we are looking at here. But I agree that's something which we are closely monitoring in other research studies. But the studies which we mentioned here should not be affected with the any of the federal. And I think the most focus was in DEI, but we'll see how it'll be in future. We do have, I mean, since we don't have any further questions, but I just wanted to let you know that at KU we do focus not just on treating patients and seeing patients, but we do would like to develop science also. And so we do have research going. Most of us do like clinical research, although we collaborate with basic scientists also. And we do not just a single center, but collaborate with other centers and international centers also across the globe. And as you know, Dr. Dimachki has been very active in most of the myositis trials as well as IBM trials, but we also have like in other areas of neuromuscular diseases that we work on. And 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 all of us are like co-investigators on all these trials. So when he's we all work together and see patients when you come in. And we do have a large coordinator pool at KU. They really help us out, like Nora and a team real. And once you're in a trial, we monitor you closely, and you'll have the numbers that you can call if there's any problems at any time. So we do monitor closely, and follow the regulations strictly on these trials. And like I mentioned, we do have a research unit that is dedicated to research center, where the nurses are mainly helping out with research patients who are participating in the research through any of our research trials. And this is a unit where all the IV treatments, as well as injections or anything needs to be done, or blood tests or other things can needs to be done, will all be scheduled there. Sometimes we may see you in our clinic for research visits. If the doctor who's seeing you that day is cannot come all the way to the because of the clinic appointments, we may see you at the clinic location. We do have another location in the main hospital also, which is also a research unit. Sometimes we see our patients in that also. It's a clinical trials unit also in the main hospital. And the studies we mentioned do not require hospitalization, but some of the other studies we do have hospitalization where we may admit to the hospital. But none of these studies